Hello. I thought it would be important to spend a few moments talking about pancreatic cancer. Although this cancer has been considered in the past somewhat rare, its incidence has vastly increased. Now, in order to think about this just a minute, I'd like to remind you that the pancreas is one of the endocrine glands that we have that we kind of call a velvety gland. And it's unprotected by a tight connective tissue covering, much like the thyroid, the adrenals, and the pancreas. And without that connective tissue covering, the bioelectric net that can help deflect abnormal frequencies is absent. Therefore, the thyroid and the adrenals and the pancreas are very, very vulnerable. Now, the pancreas is kind of like a little fish that's draped across the back of the abdominal cavity, and it is kind of draped over many major vessels. And the head of the pancreas is where the intersection between the intestine, the small intestine, the part of it, the starting part of it, the duodenum, as well as from the right side, the liver, bringing bile into the intestine to emulsify fats, also enters in that area. So the head of the pancreas is a very, very important zone. And people who get pancreatic cancer, it's either in the head, in that busy zone, in the middle, or the body, which can be overlying major vessels, and the tail, which is also adjacent to the spleen in the left upper quadrant. The big problem with pancreatic cancer is that people don't know they have it until they do. Many people present to the emergency room with some type of abdominal pain and are then diagnosed after they do a CAT scan and find a tumor. The best prevention is keep your pancreas safe from electromagnetic frequency emissions, which can be averted by being careful when you use all of these electronic devices that we have in our world. Computers in particular hit a patient right in this area, and this is where the pancreas is. So if you can protect yourself from those things that you sit in front of all day long, day in and day out when you're working or using them for leisure, this is a very, very important thing. At the same time, we have other issues that can predispose a person to cancer, also related to viral infections that may or may not be detected. So when we have a patient with pancreatic cancer, we want to look at those underlying issues, diagnose them, treat them, assess to see whether or not they're a good surgical candidate, and go forward with recommendations. Thank you.